So on behalf of Secure Dental, my wife Nazish Jafri and myself, we welcome you, the NYU team, Michael Connor, Vice Dean, Ryan, and Gabby. So with that being said, we are here today at a very special occasion for our Veterans Day and treating our veterans here, getting the free dental implants and dental treatment. We've just mimicked what NYU is doing with the VOCARE program. I wanted to say special thanks for you guys to come out and fly out to this special event and share this experience with us. So,
Well, thank you both for inviting us to be here. It's been a wonderful experience for us to see your operation and to see how well you're treating all well-deserving veterans. It was a pleasure to see your staff, your providers taking such care of the veterans that you were treating today. I must congratulate both of you for your generosity of doing something like this today for well-deserving veterans.
thank you.
You have both, I've known you now for a couple of years, and I know how dedicated and committed you are to providing the best oral health care and dentistry that you can to deserving veterans, many of whom have sacrificed to make sure that we're here protecting us and our freedoms. So thank you both for inviting us here. It's a very, very special honor to be here today with both of you.
It's great having you.
And additionally, Dean O'Connor, speaking of their generosity, I think just out this morning was our own press release and story highlighting our very specific generosity for the VOCARE program and their $1 million contribution to support those veterans we're treating back at the school, specifically for those really, expensive, really multifaceted treatment cases that are a challenge for us to cover the costs on, and I think really allows us to continue to do the great work that you and Gabby both allow us to do at school.
That is an amazing, amazing gift, and we are so grateful that you have found it in your hearts to provide us with such generosity for our veterans. Gabriella, I know, will make sure that that money is put to very good use to take care of our veterans for all of the special cases that we need to provide for the veterans. Gabby, how many veterans have we treated thus far?
So first, thank you for the invitation and the generous gift. It's a big blessing for us. And thus far, we've treated, in the 3 years span, we had 3,300 patients. So at almost over, now it's 60,000 procedures have been done. Wonderful.
Amazing. It's amazing.
And this is all pro bono. The veterans do not spend any money. So your gift of $1 million, I will say that again, that's the largest gift that I've ever been associated with at NYU. So we're very grateful, and that allows us to do a tremendous amount of benefit to the overall healthcare and health outcomes of our veterans. So thank you very much.
It's a collaboration for sure, and it's a teamwork, like we all know, right? So I wanted to ask you a quick question here. So what was your vision? When did this whole VOCARE program start? What were you thinking before that, and why?
Well, the story is personal, to be honest with you. It's personal both by Gabriella and myself. We both had family situations in which family members had served in the military. What happened was the dean of the school, Charles Berlami, was responding to a notice by the VA group in Washington that they were looking for a partner to do a pilot study to take a look at veterans and rural health care. And something like that would normally come by my desk to say, who do we distribute it to?
Sure.
Michael, who is the right one in one of our departments that would be interested in maybe responding to this RFP, request for proposal? So I showed it to Gabriella. Gabriella, in addition to running the VOCARE program, is involved with me in strategic initiatives. And I said to Gabriella, in that role, who do you think we should send this to? And she said, Michael, why don't we do it? I said, well, why should we? And she said, because of my brother. And I said, tell me a little bit about your brother. So maybe you should talk about your brother Rodney.
So my brother Rodney is a Marine. He's my older brother. And he had served twice in Iraq and then in Afghanistan. And it was personal to me because, I mean, obviously he sacrificed his life. And I was young then, and just seeing you, to your older brother goes away. So you're kind of like nervous, and is he going to come back? And I know my mom was probably, aside from my brother himself, probably the most worried. I remember every night she'd like keep praying and praying to come back. And then when he would call, it was next. And hear his voice calling and I saw that he's fine.
So Gabriella's personal story about her brother really was the catalyst for me to think about maybe we should do something. It also reminded me of my experience that I had with the VA with my father. My father was a very proud veteran of World War II, and he had been, I didn't grow up with my dad, but he had a lot of illnesses. And there was a time when I went to visit him by chance, and I saw that he was ill. And I took him to the Bronx VA because he lived in the Bronx. And I took him there and he told the residents at that time that my father had scurvy. And they said, no one has scurvy anymore. And I said, my father does have scurvy. He's a hermit, he's alcoholic, he doesn't eat, he doesn't have any vitamin D, he has no sunshine. He has scurvy and they wanted to release him. And I said something that I can't repeat right now, but that if you release him, I'm going to hold you all personally responsible. And that began a 20-year journey of me taking care of my father. During that 20-year journey, including that first couple of days after he was treated for scurvy, my father had no teeth. He had basically one or two front teeth, like chiclets. He couldn't chew, he couldn't eat. And I asked them if they would be kind enough to get him a set of dentures. How much could a set of dentures be, right?
Right?
So turns out that over that 20-year period, my father had not only scurvy, he had diabetes, he had trouble with his eyes, my grandfather had glaucoma, we had to stop and arrest that. He had a heart attack. He had cancer of the throat. They removed his larynx. Ultimately, he had a stroke, couldn't move his left side of his body, and we had to put him in a VA nursing home, which was absolutely wonderful. And they treated my father beautifully in all those illnesses that he had in that 20-year journey. The one thing we couldn't get from my father was teeth.
Wow.
We couldn't get teeth. And I couldn't believe it, and I fought hard at every step of that 20-year journey, but totally unsuccessful. And what made me think about that situation starting at the Bronx VA with him at scurvy is what would have happened to my father if, in fact, on that very first illness of scurvy, that we had gotten him a set of dentures. Would it have changed his life? Would it have made him feel better about himself? Would it have enabled him to maybe stop being a hermit? Would it maybe stop him from drinking? His diet was total drinking. That's all he did was drink. Would it have changed? Would he have gone to a wedding? Would he have gone to a funeral? Would he have gone to a baptism? Would he have gone to anything that was family or socially related, as opposed to being a hermit and compounding his health stays by getting all these other diseases? Could we have arrested any of all of that? And that was the frustration I had for 20 years. But when Gabriella said, let's do this for Rodney, it made me think about my father. And then the rest was history. We applied for the grant. There's no money behind the grant, but we applied. They picked one community health center. They seated Dental College as a community health center in the whole country. It was us, and we were very proud to have been given that award. We worked very closely with the VA in Washington and our partners in New York City. Without our partners in New York City, this project wouldn't exist.
So what is it like for our veterans to be treated at the VA? What is the percentage that's getting actual care?
actual care at 5% get receive actual care in the VA.
Okay.
That's nationally for, wait, what about us?
For our in NYU,
Yeah, is that what you're asking?
Right. We're asking for the VA and NY comparison.
Oh, so do that national, I interrupted you.
so in national, it's a 5% receive care at the VA. So they don't do comprehensive dental care, which is where we come in and we provide comprehensive dental care for the VA patients.
Okay.
So 5% on 18 million veterans. There are 18 million veterans alive
All right.
in the U.S. today.
5%.
9 million are enrolled in the VA healthcare system, but only 5% of all the veterans who are alive are eligible for dental care, which is really tragic when you think about what these veterans have done to protect us. Being away from how many years was Rodney away from your family?
Most of my teenage life.
So you said 2 tours, right? In Iraq, and then you have 1 tour in Afghanistan, and he stayed there for a while.
Yep, he did stay there.
So would he say like around like more than
I was going to say,
6 years? More than 6 years. Wow.
so Ronnie sacrificed 6 years of his life to be in harm's way because the areas that he was in were not necessarily the safest place in the world to be.
Oh, of course, yeah.
And he was a Marine, is a Marine, still loves the Marines as far as I know. And thanks to his efforts and many, many other of our veterans have protected us. I think Ronnie, is he a patient of ours?
He actually recently became a patient, and although his provider graduated, but he did become one for his cleaning after he switched jobs, and then he actually likes being there. Like I said, the providers were great. They treated him nicely, and they were very efficient and communicative as well.
And the nice thing is we did not tell anybody that Rodney was.
No, it did not tell his provider.
So there was no special.
They had no idea.
Your shopper. Was your shopper?
The only one who knew was one of our worker bees, Nilsa. She was the only one who knew he was my brother. She called him, even though he tried to rush her off the phone to his schedule. But when he went in, nobody knew he was.
No, he was Nilsa's a scheduler. So she's not on the floor. She's not in the clinic.
Yeah, no interaction.
She would have no interaction with the provider or the student or anybody else.
Right.
She schedules, so she's the only one. So whoever treated Rodney as any other veteran patient will be
I
treated.
can vouch for that myself because being a student of NYU, when I was at the clinic first, one of those first things that we actually had to practice was dress and manners.
Oh, is that right?
Oh, yeah. And being, ethics was one of the other subjects that we had to master. So I can vouch for that. So I think Ronnie is in good hands.
He was the only way the provider knew who he was my brother was because my brother started talking.
Oh, okay.
And then the provider had gone with us on one of our our leadership track programs. And he said, "Oh yeah, I know your sister. She was there with us." And then that's how he knew.
Nice. Now this is even special treatment.
And then he got beat.
All right.
But we treat all of our patients, regardless of where they come from, the same. We treat everybody with the ethical
Quite.
level of care that we need to provide, as well as treating everybody with respect. We have a very diverse population, as you both know. Many of our patients are on the lowest socioeconomic strata. And we have a major disability center in which it's a beautiful facility, and we treat the disability population with enormous respect. We go out of our way to make sure that when they come in, it's the best possible care that anyone get in this country, and we treat our veterans the same way. We try to do that across the board for all of our patients.
And the best part is it's free.
Well, it is free. We provide total free care to any veteran in New York City who is enrolled in the VA hospital system. That was one of the quid pro quos that the VA counted.
Okay.
So we've had some patients who have reached out to us who are not members of the VA. And what we have told them, one that I happen to know from my basketball exploits in Staten Island. One of the maintenance men in one of in the schools knew about the program from his principal, who knew me in basketball. And he came in, and I said, "Are you in the system?" He said, "No." I said, "Well, you have to enroll in the system. So go to Fort Hamilton
That's a great
in
point.
Brooklyn, and you have to enroll because, in fairness to the VA, they wanted to bring back that patient into their system so they could follow him not only for oral health, but for other things as well. And he's done extremely well. He's had all of his teeth removed and replaced.
Nice. Well, you know, we had a few conversations with our patients today, and one of those things that really caught my attention was like how shocked these guys were that they did not have to pay anything for their treatment. And came to a point where a couple of them even thought it was a scam, or we were going to upsell them something. Right. And so, you know, our conversation with you this morning was, Ryan, I want you to elaborate a little bit more. Tell me, what is the psychology behind it? Because, you know, when these patients see, it's too good to be true.
Sure. Why do you think that is? There's some value anchoring that happens there, right? And so if something has no cost, it has no value in the way that we think about it.
Right.
And I think the analogy we use is the lobster roll analogy, right? And so there was a point in time when McDonald's offered a lobster roll, and they offered it for like $3.99 or $4.99, something that immediate kilo. It's a very, very low price. And everyone felt like this was imitation crab meat, right? Like this can't be real, this is nothing. But what people didn't or don't realize is that lobster used to be, peasant food, right? It was what was thrown away, it was what was given to prisoners. It was not unbountiful tea, but then, aristocracy and whatnot turned it into a delicacy. It doesn't actually have anything to do with its availability or its price point, but what marketing found is that the more you charge for it, the more desirable it becomes, right? And so while you would trust and maybe pursue and really enjoy a $30 lobster roll, you would be very suspect of the $6 right over I can't possibly believe this. And so there's something in us and in sort of like our general, society that says, if it's not expensive enough, it's not worthwhile. And particularly when something's free, and with this population and with the disabilities population, they are also a vulnerable population. True. Right? They're not offered a lot of services. And so when they are, there are certainly people who prey upon that. And there are people who take advantage and seek them out, to do so, either to get their own benefits, to try to get governmental, to scam them, or any number of
And they're not wrong to think that way.
No. They've experienced that either, individually or systematically. And so they're suspect. But, as I said to you guys coming in this morning, then they're treated in that respectful, appropriate, appreciative way, and they receive this care. And this was, one day and in their oral health journey and one portion of their lives. But how does that extrapolate out into the rest of their lives? Sure. Hey, this is how I should be treated. I shouldn't, be taught to expect the lowest possible denominator. I should be taught to look up and see what I can do and where I can get to. And so I think you guys are really setting that bar.
So is that a good thing or a bad thing to raise a bar?
Either way, right? It depends. Yes, it doesn't make it difficult. But if we can inspire people to demand more in their lives, then, I'm okay being guilty of that.
Well, the partnership that our VA friends in a hospital really is very, very critical, establishing that credibility between the two institutions. So it's important to note that the referrals come from the primary care physician who is treating this patient already. Okay, and the patient is being treated by somebody they may or may not trust. Many patients, as you all know, don't trust the medical work.
Oh, big time.
All right. So, and we have a lot of that in the veteran population as well. But what does help is that the primary care physician is the one making the referral. There's hopefully a relationship between that primary care physician and the patient, and then they're coming here to be treated by the NYU Dental College. There are times, though, I'm sure that given the background of many of our veterans, that they are a little bit questionable in terms of the saying, well, why would they do this for us? Why are they doing it for us? And what we try to do is to make sure that at our bedside manner, that our clinicians, our student doctors all know to treat each patient with words, dignity, and respect. And to make them feel as if, in my view, whenever I talk to somebody, I hope they know that they're the most important person in my world at that moment. And I hope our clinicians feel the same about the patients. So it's a double-edged sword. We treat a lot of people, 30,000 visits in 3 years. That's 10,000 visits a year. Our goal was 5. We've doubled it. And of course, things happen occasionally, but by and large, the feedback we get by the veterans is absolutely amazing. I would say, in addition, it's a wonderful experience for our students and our faculty. They love providing the care to the veterans as well. And in fact, several of our students are now going to dedicate themselves to just what the two of you have done, not just today, you've done it before, and we know that they are going to sacrifice and give back to a veterans. Anthony Allison is an example where he will do a week, a year of free care to veterans. Excellent. As a result of being involved in our veterans program.
I think it's very humbling to see this, even in our little organization that we have backed by you guys, is even this one-day event was not just me and him. It was my whole team organizing it. And it's like my manager, my operations manager, 3 of the other managers, our lead dental assistants, everyone gave their time. We just gave them the space and the opportunity. They didn't have to do it. My associates didn't have to travel 3 hours away to be here. There was a non-productive day. But they did multiple extractions on one patient. They did 3 implants on one, 4 on the top, 4 on the bottom, just giving away their skill and time. Pretty humbling, because I heard people saying the same thing as he was saying, that what is the catch? And they didn't understand, some of these patients didn't understand why we were doing it. And they were thinking something's gonna come up. They might give us a bill or something like that. But they were just going through the treatment and going through the hallway saying, is there anything else? Is there anything?
You told me we're all silver.
Yeah, they thought we were gonna upsell them, but they were saying that's it. And they were so gratified with the treatment that they received, because nobody would even extract their tooth. Or the way they got treated. There was one patient who my associate was doing just a single implant, and she kept asking, you're okay? Are you feeling any pain? And he was just so overwhelmed by the way she treated him that when he was walking, he said, I have never been treated like this for a dental facility. It was Dr. Hope Yoon's patient. So, and I heard, and I was just hearing it, and I'm like, this is totally humbling. I'm very proud of the fact that with our little space, my associates are able to feel that they're gratified, and you take gratitude then. You're like, okay, we're doing something. Everything doesn't have to be monetary value. They're just giving their time and having the experience. So
That's so inspirational to hear that.
yeah.
That your team did such great work, number one, but felt really good about doing it. It would be wonderful if we were able to work together to build on the momentum we have now to do something more on a national level.
I think we should do it.
But our alumni, right? We are the largest dental school in the country by far. We have the largest alumni base by far. If we could partner and use you in a very positive way as an example of alumni being very engaged in providing a free service on Veterans Day to our veterans and get a fair amount of people, like 100 alumni. Let's shoot for 100 next Veterans Day
Let's do it.
and see if we can get, Ryan, we're giving you a challenge here.
Even he's so I'm like in a whole year to do it. I think
I always say like, and I always say when. Right.
Okay,
Right. I always say when.
okay.
That's number one. And number two is, I want to say that, we were so inspired by the whole VOCARE program
Yeah.
that we actually upped our game like this year. Not only that, all of our providers who are treating our veterans today, they're all non-paid.
Really?
Yeah, they're all no.
All of your providers.
All my doctors who came in today and who's going to be doing it, we have like 3 separate days that we do
We
it.
have one on the 16th, one
Correct, on the 22nd.
first, and maybe second.
Wow, that's amazing.
So we had it on like 3 or 4 locations, and those guys, they're all going to be like non-productive. Let's put it that way. And they've all volunteered to do it just because they saw our passion and how we were involved.
Well, and that is the inspiration. Exactly. That is setting the gold standard to say, I'm willing to do this. So what are you willing to do? And I think as we look for those 100, when we look for 100, right, between now and a year from now, that's what we'll be looking for. We're looking for others in their local communities. We're not asking them to go outside. Like, really, you're going to make a difference at home, right? In the same way that you're treating people that are right here in the community, we want those folks to look at their communities and say, I can do that. And if I can do it at yay level, great. And if I can do it at a little bit lower level, but I still want to participate, great. And so we'll look.
I would say even if it's free exam or cleanings, whatever. I mean, they don't have to get points. They don't have to be full arches. Even something.
See, this is a grassroots level project,
Yes.
right? We're doing it from the ground,
Yeah.
and we're working towards a bigger picture. The ultimate goal of some of the work we're doing and why it's important to get other people involved in it nationally is the influence we may be able to have on Congress. The ultimate goal really is that, good intentions notwithstanding, we need more. And what we need is government support for oral health care for our veterans. And if we start to build a momentum, and then we do a little R word, some investigation, so that we can show that health outcomes are really in the best interest of everybody, because it's cheaper to keep somebody healthy than to have my father's illnesses cost millions of dollars. If we can prevent it, if you think from a public health perspective, as opposed to just what's in front of you, that would go a long way to improving the veterans' lives. But also, it's an economic issue. It's a smart economic decision. So I don't know how they're going to get there. I have some ideas. You start small. There's all kinds of ways of getting it started. But we are starting a grassroots project, and thanks to you and to you, we're off to a great start. And if we get more alums next year, that will gather attention. There will be an awareness raise. People want to come out of the woodwork to help because it's a good thing to do, and people want to be part of a good thing.
100%. This time next year, we'll be having a different meeting.
That sounds right to me, and that sounds right.
Yep. Well, we're all going to be in a different city, so we're going to be spread out across the country. That's going to be very exciting.
So again, I want to thank the two of you on behalf of the NYU College of Dentistry and for the VOCARE program specifically, for your generosity, your compassion, your dedication, and your friendship. This means a lot to all of us sitting here and to the rest of the school as well, and to our veterans. So thank you very much. We really appreciate it, and we're very grateful. Thank you.
We are on the same page.
Thank you.
Thank you.